breathing to get more shallow, may even empty bowel and bladder. What's happening is rabbit's mind is actually causing body to get stronger. It's sending increased oxygen, glucose, and adrenaline, directing it towards rabbit's legs so rabbit can run faster. When you have fear, that's fear, it's your body making you stronger to get away from something that seems threatening. If the wolf catches the rabbit, and the rabbit, will turn to fight or bite, energy will go up, jaw will clench, face will flush. Think about people when they're mad. It's upper body stuff, because the body is wanting to lean forward and bite what is threatening. So when it's anger, your mind's wanting you to stop something from happening. And our minds too, even though we know it's not cool to bite people, that's exactly what your mind's telling you to do. It's telling you to bite that guy and make him stop that. So this is fight, flight, and then what will happen if you cannot run from the threat and you can't fight it off? The next adaptive thing is that your body will freeze or go limp. It's not always just a freeze. It's more like playing possum, because in the animal world, if the predator's prey seems to have already died, it's not sanitary to continue eating it, and so a lot of times it'll drop the prey if it thinks it's already died. But there's another reason. There's less injury when your body's limp and loose. So you've heard about people being in car accidents that were drunk and walked away from the thing with barely a scratch. It's body being loose and limp. What causes injury is resistance to something. That's what causes breakage of bones and different things like that. So I'm telling you this because the thing that freaks people out with trauma that get PTSD is the helplessness they feel. That's who tends to get this, in addition to the other symptoms and vulnerabilities that we talked about. It's when people feel like, there I was in this life-threatening situation, and I just went limp, and I was paralyzed. I'm weak. I'm like, no, that's not weak. That's your body was doing the most adaptive thing. Had you done anything else, you probably would have died. I always help them look at that. It probably would have been worse. You probably would have got hurt. Because that's the thing they can't wrap their head around, why my body did that. Here's the problem, though. When this thing's activated and that fight or flight response goes off, it's meant to last about 90 seconds to get you out of danger. But people have that thing turn on for 12 years, being upset about something. Only humans do that. Animals update in about 90 seconds. Rabbit goes back to hanging out with his girlfriend and eating a carrot. And no rabbits have PTSD. It's because rabbits don't have a prefrontal cortex, okay? We have a prefrontal cortex, and it's the part of our mind where we do our thinking, planning, organizing, and this is where kind of our conscious mind is housed. That's about 10% of your total mind's functioning. Here, this is 90% of your total mind's functioning, and it functions at about the level of a goat, okay? So it's very intelligent and things like an animal. What's happening is these two don't communicate well together sometimes. So our minds are more complex. They're more prone to glitches. They're more prone to screw up, kind of like your car or your computer. So what we know now is that when this goes off, it actually inhibits this part of the brain because it doesn't want us analyzing things. It just wants us to go on base instinct to get away from a threat. So if the rabbit had a prefrontal cortex, rabbit's mind would not want it going, I wonder what breed of wolf that is. I wonder what his name is. Where did he come from? It doesn't want you analyzing stuff. Just get out of here. The other thing it'll inhibit is this little seahorse-shaped area called the hippocampus. And the hippocampus is what organizes our memory into context, into time and space. It's where it's kind of the symbols from your emotional brain sends conscious memory up here. So when this fight or flight goes off, it inhibits hippocampus, inhibits prefrontal, and that's why that imprint's left here, and you're reacting to it all the time because it's down on that level. What trauma therapies are doing now, we're all about getting it up here, getting it assembled properly into your brain, and when it's in that proper context, you won't have that similar and same thing anymore. get triggered, you won't have the nightmares, because your mind gets, it's done, it's finished, and it's good, I got through it. So Bessel van der Kolk is a very popular psychiatrist, a specialist in trauma, and he's the first one that talked about PTSD is not an anxiety disorder. In the DSM, it's listed under anxiety disorders, but he says, it's actually a disorder of memory, and that's what we got to integrate, the memory. We used to have people do that by telling, like he worked at the VA, and he said, we had these guys going through the story and reliving it. We thought it was important they got all the feelings that went with the event out at the same time. But what happened is they were just activating that amygdala and not getting it through. Now, eventually it worked, but it would take a long time, and it was very painful. Now he says uncontrolled exposure has devastating effects, and he's also a big proponent of the main thing we need to do first, before we have them talk about the events, teach them how to calm themselves down, to stay present. So that's what you're going to see in a lot of the current therapies for trauma. It's all about teaching. You'll hear about mindfulness. You guys know what mindfulness is? So mindfulness is observing what you're feeling or thinking without judging it. Just got your observing mind going, noticing stuff. And when you practice mindfulness, guess what? You grow that medial prefrontal cortex part of your brain. It can get denser, thicker, and that seems to be really valuable in regulating emotions. So people who practice meditation 20 minutes a day, 8 weeks, you'll already see a brain change in 8 weeks. Yoga and Tai Chi is something that's being integrated more and more. And the thing about yoga and Tai Chi is that it's also helping people get connected to their bodies again. You also hear about biofeedback and neurofeedback being used, where people learn how to see on the screen what their brain's doing and how to regulate it back down. I just want you guys to be aware of what people are doing, and you can decide what you like, what works for you. There's eye movement desensitization and reprocessing, EMDR, that you may have heard of. And Francine Shapiro, this is her up here, she says that she herself isn't completely sure why it works. That there's a lot of theory that we're integrating right and left hemisphere, because you move your eyes back and forth, or you could use sound or tactile things. I think part of it is you're staying present, and that's part of it. Pat Ogden and Peter Levine both do body-oriented psychotherapies to help people feel the sensations and just kind of notice them with mindfulness types of activities and ride through them. Peter Levine also talks about we've got to complete the freeze response. There's some theory that part of what's happening with trauma is that your body wanted to escape, and it got stuck in that freeze response, and it hasn't realized that you escaped yet. So there's some theories that actually make you, like martial arts are using with vets, where they're finishing out what never got completed. So I use a method called rapid resolution therapy, and this works for me. I like using this method. I've been using it for 4.5 years, and it works beautifully. And it just fits my personality. With rapid resolution therapy, we use elements of imagery, hypnosis, humor. Use a lot of humor and telling stories. And it's real creative use of cognitive behavioral therapy. And I found using that, I can clear a trauma within 1 to 3 sessions. A lot of times in 1 session. And it's amazing. So that's what you're going to see with Joe here. One of the things we do first